with a subretinal crystalline lens. It's a dramatic surgery. Aniruddha, he is head of the department and senior consultant at Shustruth Eye Hospital, Kolkata, and joining with us very soon.
Thank you. Thank you, Rupagda, for this opportunity. Well, I will be showing one referred complication. Audio is there.
This is the story of a lost nucleus. This patient was referred to the retina department
Yes.
lost nucleus after a complicated cataract surgery. On examination and investigation, it revealed a hemorrhagic choroidal detachment with total retinal detachment. But the nucleus could not be localized even through ultrasonography. We initiated the case by draining the choroidal hemorrhage externally after placing an AC antenna. Wound was properly closed before proceeding with vitrectomy. It showed a giant retinal tear with extensive anterior PVR changes. After doing a core vitrectomy, PFCL was injected to stabilize the posterior pole. Membranes were dissected from the disc to unfold the posterior pole. Even after doing a thorough vitrectomy, the retina couldn't be settled. And the most surprising aspect was that we could not locate the dropped nucleus for which the patient was referred to us. To settle the retina, we decided to perform relaxing retinectomy. While doing the retinectomy, a yellow mass was seen subretinally. Further retinectomy revealed that yellow mass was nothing but the dropped nucleus. We then extended the retinectomy to release the subretinal nucleus, and then with a fragmentome emulsified the nucleus. After removal of the nucleus, 360-degree retinectomy was completed. And laser was performed. One piece of the nucleus went underneath the retina while doing the phagofrag. Which we eventually retrieved and completed the case by direct PFCL silicon oil exchange. We could give the patient from light perception to ambulatory vision of 5/16. Hence, the take-home message from my video is a retinal surgeon should never ever give up. Thank you.
Excellent. Excellent show, Aniruddha. Excellent show. We'll take a quick comment from our panelist, Dr. Manish. And before that, there is a little announcement that Dr. Srinivas also has to leave for another session. So before Dr. Aditya, can I request next is Dr. Srinivas to present? Yeah, Manish.
So I had a question as to how did how the lens must have ended up in.
I think there was.
They tried to do a lot of fishing of the.
There was a lot of manipulation, maybe, which created the giant retinal tear. And this patient actually presented 3 weeks following the surgery. So might be through the giant retinal tear, the nucleus has migrated subretinal. So that's a possibility. In fact, it is a message to the anterior segment surgeon not to manipulate. So this kind of worse scenario might actually arise.
And ultrasound revealed.
Actually, there was a choroidal, suprachoroidal hemorrhage. The globe, there was GRT. So definitely the ultrasonography was not very clear. There was obviously a clinical suspicion because the patient was referred for dropped nucleus. But it was actually a disorganized globe, it seems to be.
Excellent surgery under the situation. I think you did a fantastic job.
The cornea condition was also pretty bad. You can see from the video that it was a little bit hazy.
Absolutely.
You understand. Dr. Chawla, please. I think you wanted to.
No, I think it's a beautifully done surgery and one should never give up, and GRT must have been responsible. And the early setting in one of PVR was because of the associated hemorrhage and because of over manipulation.
Inflammation. Yeah.
The whole surgery could have been much easier without the associated PVR and the nuclear contour.
I agree with you.